Our webinar today. We're really thankful for you to be here, and we'll hop right in just to get started on time. My name is Nandini Singh. I am the Coalition Director for the Northern California Coalition for Social Connection at UCSF. And I wanted to start off a little bit introducing our work, introducing Social Connection Week before we jump in. And if I can, there we go. But just to do a quick overview of our agenda webinar today, I'll start off and then I'm going to pass it to Morgan Marler from the Foundation for Social Connection to walk us through a really awesome tool that the foundation has created that can be really helpful with coalition building called the Action Guide for Building Socially Connected Communities. After that, I'm really excited to welcome four panelists of coalitions for social connection all across the country. So we're going to engage in a panel with them, learn about their work and their advice for building coalitions. And then at the end, we'll have about 10 to 15 minutes for them to answer your questions through the Q&A. And then we'll wrap up at the end with a closing. So, a brief background on my coalition, which is based out of UCSF. We're housed at the UCSF Division of Geriatrics through the Social Connections and Aging Lab, which does a lot of work studying social isolation and loneliness among older adults. And here you can just see a brief overview of some of our work in that field and that research. And I can drop the link in the chat in a little bit for you to read more about that. But the coalition was born out of, our principal investigators, Dr. Carla Personoto and Dr. Ashwin Kotwal, doing this work, but really wanting it to be in connection with the communities that surround them. So they were thinking about how can we use this research to create a space for building communities, supporting these efforts that are on the ground. And that's kind of how the coalition came to start a few years ago. And a quick overview of our coalition's goals at UCSF. We want to serve as a resource for evidence-based research and programming, promote collaboration between institutions and communities, raise awareness for social isolation and loneliness as a public health issue, which is a lot of how Social Connection Week came into being, directly enhance social connection among older adults, and advocate for funding and policy changes to support these initiatives. And so, briefly, I wanted to highlight the rest of our Social Connection Week events. We're starting off today with this wonderful webinar, and we have some local in-person events throughout the week, as well as another webinar, which we're doing with the California Volunteers Office of the Governor, more about intergenerational programming and connecting with your neighbors. So if you're in the Bay Area, would love to see you at the resource fair and panel we have tomorrow, as well as the community celebration that we'll have on Thursday. If not, would love to see you on our October 8th webinar as well, which I'll drop the link in the chat for later. And so now I wanted to move into welcoming some of our amazing presenters. We're going to start off with Morgan from the Foundation for Social Connection, and then welcome our panelists after that. So I'll pass it off to Morgan. Thank you.
Thank you, Nandini. So excited to be with all of you today. I always feel funny about being on Zoom webinars because you can like see panelists, but you can't see attendees. So just know that I'm saying a big hello to all of you that are joining us. And I do see some familiar names. Thank you all so much for being with us. My name is Morgan Marler. I serve as the Associate Director for Network and Partnerships at the Foundation for Social Connection. If you are not familiar with us, we are a 501c3 nonprofit based in Washington, D.C. We are founded in 2020, and our mission is to advance social connection nationwide, rooted in evidence for our collective well being. And our work is organized into three pillars: translating research into practice, creating long lasting partnerships and community opportunities for field builders, which is the pillar that I get to oversee, and then prioritizing social connection as a national value powered by lived experience. And that really comes through in our storytelling, communications, and culture shift. We work closely with our Scientific Leadership Council, which includes Dr. Parasinoto and Dr. Ashwin Kotwal, who Nandini mentioned earlier. Um, And it's really comprised of some of the leading experts on social isolation, loneliness, and connection, as well as our larger scientific network. And it makes possible us bringing the evidence into strategies and policies for greater connection. A beautiful example of that is our action guide for building socially connected communities. We also work very closely with leaders across the country, including the ones that you see on your screen today, to really help develop and implement best practices tailored to communities and populations' needs. And really, ultimately, our vision is a vibrant society where social connection is at the heart of how we live. Today, I'm going to talk a little bit about our action guide for building socially connected communities. This tool was first came into being in September of 2023. So we just celebrated 2 years, which is really exciting. But the work really began in 2022 as we engaged with CDC and NACDD on the Building Resilient and Inclusive Communities work. Through that, we had the opportunity to interface with a lot of different community leaders that were excited and really kind of eager to work on social connection, but didn't really know where to start. So this was a beautiful kind of opportunity to take the research and the evidence and really create a tool, a framework to support those local leaders in going from recognizing this as an issue in their community that they wanted to work on to actually being able to implement something. Um, we to date, and the site is listed on my slide, have had 22,000 people visit the site. And we've been really fortunate to work with 5 communities very closely through our Action Guide pilot cohort. But before I get into that, I just want to talk to you a little bit about how the tool was developed. So I mentioned that it was published in 2023. We worked very closely with different practitioners across the field, wanting to ensure that we were not recreating the wheel in any way, shape, or form. So we did an extensive literature review looking at existing models and frameworks and current research, and then also consulted organizations with similar guides. We then teamed up and convened over 60 local leaders in 4 different places in the US for community listening sessions. So that's Bangor, Maine, San Antonio, Texas, Atlanta, Georgia, and Hennepin County, Minnesota. We then took all of the data, qualitative and quantitative, from those sessions and actually worked with Dr. Julianne Holt-Lundstad and a team of her students to review and analyze that data, both session notes as well as different surveys that we gave to highlight recurring takeaways that really helped frame the guide. We then got to engage with local mayors and city leaders to really discuss the challenges, solutions, and the opportunities really required to support them in whatever the planning tool might look like. We then wrote the guide and published it, as I said, in 2023. You might be asking, what was happening between 2023 and now? I will definitely share that in just a second. But first, a quick overview of the guide. So the guide is in 6 steps. Each of them has quite a bit within it. I would like to say that we, as kind of a research-based, evidence-informed entity, um, wanted to put all that we could, but then also like kind of wanted to make it manageable. So we broke it into these 6 steps to really help kind of chunk out the content. So the first step is really about reflecting. And that is a leader reflection that has a couple of different questions to really kind of frame the assets in the community as well as the populations that you want to focus on. And then review really is about what's the current state. So there's our data dashboard sits in that step and is a county level dashboard that has 15 different indicators that kind of point to the state of social connection in your county. Then we have Collaborate, which has our community listening session, as well as our partnership mapping exercise. The partnership mapping exercise is really to kind of help brainstorm who are the likely and unlikely partners, or maybe the surprising partners that you can bring to the table to do this work in partnership. I think it's sometimes the most unlikely partners in this work that are kind of the most fruitful and like best surprises. One that I love to give an example of is in some work that we've done in South Jersey. There was kind of disabilities rights organization and a park organization that came together. There was like a little pot of money, and they actually did some like trail restoration and accessibility together. And it was just kind of a really beautiful example of partnership. We then have step four, which is where I like to say the rubber meets the road. That's really where the planning occurs of, okay, now that we've collected all this information about current state and who the population is that we want to be focused on, and kind of really forming this collaborative, now it's time to plan. What are our goals? What's our vision? Kind of what are the nuts and bolts of this? Then we have evaluate. We wouldn't be a research organization or kind of an evidence-informed organization if we didn't have that piece there. I think that that sometimes is like the hardest part. It's like not about like necessarily like right or wrong or measuring for kind of to see if it's like failed, but it's really about learning, right? It's like, how do we know we're being successful? Who's the population that we're really kind of prioritizing, etc. And then we have a step about sharing. So that's to really support sustainability. We know that resources are tight, and it's really important to both share out kind of what's working, but also attract in new funders, etc. So that's kind of that step. I like to think of these kind of as three different sections. So the first is around learning and preparing. The second is really around planning and implementing, and then the last is about evaluation and growth. So over the last year and a half, 2 years, we actually have gotten to work with 5 unique communities across the country. So we put out an RFA at the beginning of 2024. And we had 96 applications. And some of the folks on this call, I think, are aware of that and kind of were able to participate in some way, shape, or form. So we ended up selecting 5 communities. Those were Little Rock, Arkansas, Cowley County, Kansas, West Sacramento, California, Kings Highway, Brooklyn, and then Isabella County, Michigan. And you can see the beautiful faces of our leaders on this screenshot from our Zoom meeting. We're really excited that in the next phase of the Action Guide work, we're actually going to continue working with what we're now calling our legacy cohort. And then we're actually launching, this is a little bit of a inside baseball secret, but we're launching a new cohort, which is really exciting. It's going to be focused in New York State. So if you have anyone that you know in New York State that is interested in this work and is excited about kind of engaging, please send me an email. We're also going to be working more deeply in in Sacramento, California, County, California, as well as Imperial County in California. So really excited about that work. Two examples that I just want to name of the work that has been done with the pilot cohort. The first is in West Sacramento. So our lead organization there, or kind of our backbone entity that we've supported, and that was like the hub of the spoke, the wheel of that collaborative was Health Education Council. They've been doing some really incredible stuff around specifically repurposing the food from restaurants at the end of the day for community meals at different housing complexes across the city. So they actually kind of supported a policy change at the county level to support that. Really, really cool work. There's some other stuff that I could share, but that's kind of one kind of element. And then we have the Village Place in Little Rock, Arkansas, representing kind of one specific neighborhood in Little Rock. They created what they're calling the Dream Space, and that is really kind of a multi-sector collaborative that are working on different topic areas. So there's kind of violence prevention, there's youth engagement, lots of really beautiful things coming out of their work. Um, and as I mentioned, we're really excited, and this is kind of exciting to share with this group specifically that we are going to be launching that new cohort in New York and then the 2 communities in California. I will just plug, like, if anyone is interested in the action guide, wants a more in-depth kind of overview, presentation, etc., we're always willing to support and engage. Um, and also, if you have funders that are interested in specifically funding planning, we are 100% here for supporting in any way, shape, or form. So thank you all so much. And with that, I'll pass it back to Nandini.
Yeah, thank you so much, Morgan, for that look into the tool. And I just want to say, as someone who is running a coalition, the action guide has been is really important to me in planning our coalition meetings, working through structured activities. I think something I really love about the action guide is that there's concrete tools and activities for you to do as a group that really engages you critically and what gaps are we missing? How can we go about reaching and tapping into our network? So I think it's a really wonderful tool and a really hands-on tool that I appreciate. So thank you, Morgan.
Thank you so
And
much for that.
yeah, and now I want to take the time to introduce our lovely panelists for the day, and I'm going to hand it over to each of them to kind of give a brief overview into their work before we dive into the panel. And we'll start off with Sandra. And Sandra, do you want me to share your slides for you?
No, I will try. I'm hoping that I can do that. So let's go.
Perfect.
Okay. So do you all see that?
Yes, and then I think if you click presenter or play from start or presenter view, there we go.
Okay.
Yeah.
Okay, there. Okay, so welcome everyone, and thank you so much for being here. Um, it's my honor to share the work that's going on in Massachusetts. In Massachusetts, we view our work as a journey, and hence the signpost image here, because loneliness, as you all know, is a complex, multi-dimensional issue, and it's going to take multi-dimensional kind of solutions. We learn as we go, we shift our path, our vision, and but every path leads to one destination, belonging, and that is the vision that leads to our mission. Convened by ARP Massachusetts in 2019, when we began to see the impact of loneliness and social isolation on our older adults, ARP took the fourth step. I was the say president at that time, and we made a decision to kind of step back and take a look. So 6 organizations stepped out of their silos, and we decided to maximize our resources and ingenuity to create a statewide approach. Then came COVID, which kind of really pulled back the curtains and revealed the real extent of loneliness. And that caused us to expand our focus to see loneliness and social isolation in more areas. Today, we are more than 360 individuals representing 201 statewide, local, state, and community-based organizations. And we're all united by the mission of building connections and fostering a belonging across Massachusetts. This mission gives us purpose, but but these are our North Stars. These are the things that keep us on course. We promote social health. We spark action in our local communities. We build partnerships with all sectors of our communities around the state. We foster intergenerational connections, and we nurture a statewide culture of kindness and belongings. Guiding this work on a daily basis are our co-leaders. Ours is a volunteer-led coalition. We have no paid staff. And our leadership is provided through a 3-person co-lead model, each bringing unique expertise to guide our journey. And together we steer the coalition and the statewide initiative. Leadership, as you all know, is essential, but the soul of our work is our membership. Um, from 6 members in 2019, we are currently, as I said, 360 members representing 210 partner organizations, and we're growing. Our last meeting was 2 days on Thursday of last week, and we had 30 new members for the month of October. We have met virtually monthly for 6 years now. These are our priorities, our North Star. And these are the priorities that are guided very much by not only our vision, but also the former Surgeon General's advisory. Those include raising public awareness, strengthening social infrastructure and environments, promoting connections in all state and local policies, cultivating a culture of kindness and connections, and mobilizing the healthcare sector, especially as we get them to embrace social health and social prescription. These priorities currently guide just about everything that we do. But even with clear priorities, none of this work can happen without collaborations. And collaboration is at the heart of the journey. Which brings me to this proverb that captures the spirit of the work that's going on in Massachusetts. If you want to go far, go together. And it reminds us that lasting change comes from collaborations, from walking the journey side by side. And that's exactly what we're doing in Massachusetts, going far together. If you'd like to learn more about our work, you can visit our website at www.inlonelinessma.com or contact me directly, Sandra@inlonelinessma.com. I'd love to connect. Thank you.
Thank you, Sandra. I love that quote so much. I think it really encapsulates a lot of the work that we do. And Maureen, I'm going to pull up your slides right now if
Thank
you want to
you.
go ahead.
Thank you. Hi, everyone. I'm Maureen Feldman. I'm the founder of the Los Angeles Social Isolation Impact Coalition. And I was the director of the Social Isolation Impact Project at the Motion Picture and Television Fund, where we were also an AARP grant recipient. To study social isolation and loneliness, but to launch a program, which we did, but also to form a coalition. And so, next slide. So we started in 2017, and what started as an idea, we started out by having an event. We had the first Social Isolation Impact Summit in 2017, and we had 75 community leaders show up. We invited leaders so that they would be in a decision-making position. And our goal was really to raise awareness and inform the community that social isolation was an issue. And through the summit, we were able to educate and inspire. But one of the other great benefits, it was we were able to promote existing programs that were already available to community members. And I don't know about other cities, but in Los Angeles, we're very spread out and many of our resources are underutilized. So we really wanted to become a force multiplier. And so through the coalition, when I asked how many people were interested, this was, I think, our second or third meeting. So we were really excited. I think here we have maybe 45 of the organizations or close to 50 that were represented at that time. Next slide, please. So we have had a summit in 2017, 18, 19, 20, and we invited not just national leaders, but international leaders. We had people from the UK to end social isolation and loneliness, the Silver Line, Lisa Ryerson, the president of AARP at the time foundation, came and joined us. And it was a great way for people to network and, as Sandra said, to collaborate. One of our goals was to form an opportunity where people that wanted to form partnerships and collaborations could. Next slide. And since then, what we did is we started taking member surveys, like, what are you interested in doing? And this was, I think, a really powerful message to us. We asked the members, how can the coalition help you? And these were the results. They wanted to learn, what was the latest research? What are best practices? Can you share the up-to-date research? How to get, volunteers and to partner with other people. And as you can see, partnerships with other service providers or to network with other agencies has culminated in multiple partnerships. Several of our members have applied for grant funding together, or one would supply volunteers and the others would provide professionals, and they'd serve another organization that had a lot of clients. So the member surveys were very helpful. During COVID, like everybody else, we took a huge hit. We still met virtually, and we had what was called lunch and learns. So they were smaller meetings with very specific topics where we were able to provide training and opportunities for service providers to meet and collaborate, or academics to talk about how they could best support us. Next slide. I think that's, I don't have a whole lot. I think, oh, did I have an ending slide? Maybe not. I thought I did. Anyway, what we're doing now, I don't know what it's like in the rest of the country, but Los Angeles is facing a lot of cuts, and the Aging and Disabilities Department was basically gutted. So we are collaborating quite often with the Los Angeles Alliance for Community Health and Aging, and we're partnering with them to continue to provide information. We meet quarterly. And we're also talking right now to provide trainings. We'll also be working with the governor's office, and we're also helping organizations that want to start a social connection program, I guess, step in the waters at the level that they can maintain for sustainability. We don't want to create a blueprint for everyone when they may not be able to manage that funding. So we're working with organizations at the levels that they can, and contributing on a national level, and working with other state partners to just keep this topic in the forefront and to keep finding funding and ways to collaborate so that we normalize this issue. And for youth and older adults alike, there's no social isolation and loneliness does not discriminate. So any age, any cohort, we're there. And yeah, I appreciate everybody who's here who's interested in this topic. And I will say the one thing we did is we just kept going. We kept meeting, we kept talking, and we let everybody have a voice and put forth ideas. And it was a great way to create our own social community as well. So thank you, Nandini, for having us here, and to the other guests for sharing what they do as well.
Yeah, thank you, Maureen. And Megan, if you wanted to introduce yourself.
Hello, my name is Megan Byers. I am the co-director for the Office for the Study of Aging at the University of South Carolina. I am the convener of our coalition that is social aging. And that is a very long abbreviation. So let me explain what that is. That is South Carolina's operation to confront social isolation and loneliness. Compared to Massachusetts and oh my gosh, Jill, you're in Wisconsin. You'll hear next. We are smaller significantly, but we started in late 2023. Our coalition was first created by a task force who saw that social isolation in older adults is an issue, and they wanted to bring our entire state together to see how can we address this? How can we prove to higher officials that this is a problem, not only in Columbia, where I'm located, but South Carolina and nationwide. So that task force met from October 2022 to April 2023. And then they released their final report via press conference in June 2023 called Addressing Social Isolation in Older Adults as a Determinant of Health. And one of those recommendations was creating a coalition. So I volunteered at my office to become the person or organization to head that. We had our first official interest meeting in August 2023, and by September we had our formal name, Social Aging, and our mission and what we were going to do. Excuse me. We are a volunteer-based coalition, and we are mostly right now statewide organization leaders being involved in decision making, but we're always looking for more individuals and community members to join. Because I am a trained social worker. I'm a believer that we need to hear everyone's voice, the ones on the ground or boots on the field, is what I used to say, but also the ones in higher policy, leadership, decision-making roles come together, figure out how we can address this issue in South Carolina. So, our mission is to engage in a diverse network of partners to address the causes and the effects of social isolation and loneliness in our South Carolina's aging population. Um, and so, if you are interested in learning more about our coalition, how we got developed to where we are today, you're more than welcome to contact me. I will put my email in the box. Oh, and one last thing. Um, one, I say, barrier that we have noticed is that most of us in the coalition are state employees. The University of South Carolina is a state employer. So legislating, we can't necessarily do. So that is one barrier that I would just like you all to know if you are creating your own. Be aware of your organization's status to be able to legislate for your mission and purpose.
Yeah, that's a great point, Megan. Thank you. And I want to pick your brain more about that in a little bit. And
Yeah,
last but not least,
absolutely.
we have Jill from Wisconsin.
Hi, everyone. I will go ahead and share my slides so you can give you a little bit of a picture behind a little bit of a description of what we're doing in Wisconsin. So my name is Jill Rankin. I'm the Executive Director for the Wisconsin Institute for Healthy Aging. And we are the convening organization for the Wisconsin Coalition for Social Connection. So as you can see on the slide in front of us, so we started in 2020. So similar to Sandra, but we didn't have all of our energy going until the pandemic kind of forced us to realize that this is a huge issue and we need to do something about it. So that's when our coalition was formed. It was formed through a variety of state leaders. So we had the Department of Health, the State Department of Health Services, our organization, which we're a statewide organization, a nonprofit, and we do evidence-based health promotion programs around the state. And then also nationally. So it was us, it was the Department of Health Services. We had an area agency on aging that was involved. We had AARP is involved. We've had some other kind of partners throughout the UW Extension. So lots of like kind of statewide partners that were more expertise area was in the world of aging and health. We had several organizations in the state that were working on more of a youth capacity. So that's why we decided to really focus on older adults and adults with disabilities. So we really aim to really address the root causes of social isolation and loneliness and advance things that way. So we changed our name about 2 years ago. Instead of focusing on the social isolation and loneliness, we were focusing more on the social connection piece of, how do we build up social connections so that we can address social isolation and loneliness. So that was a shift for us, which we've seen some good positive feedback so far. So like I said, on the screen, you can see the dots. We're the convener at the Wisconsin Institute for Healthy Aging, which we found was very similar to the rest of the people we found was very essential for coordinating the coalition. And then we have a large coalition. So our coalition itself, we have a steering committee that is made up about 20 different people, but then we have over 600 members, technically members of our coalition. So we call that separate because all 600 people can't get together and plan and do all the activities. So what we do is every other month, we have our steering committee that meets, and that's where you see like the blue dots, where we have different advocacy champion, awareness ad hoc committee, policy, engagement. Those are like the ad hocs, the work groups essentially is our steering committee. And then the coalition network at large is those 600 members. So every other month we'll have the steering committee meet 1 month, and then the next month we have our coalition network meetings. They're virtual throughout the state, and we host a variety of different educational topics on those network meetings where we're highlighting best practices around the state. People can highlight different things that they're doing to increase social connection. We'll sometimes present some data, lots of different things that we'll present on that coalition network. And that's made of professionals and also just in community members in general as well. So that's a little bit different structure that we've established here in Wisconsin. So we established a website to kind of like make a space for all of this. So this is an example of what our website looks like when you first go on. So we have a section about the coalition. We have, how to connect with, we have a space for community members to connect with others, similar to the national resources, and we link to some of the national resources as well. And then we have a for professional section that really has all those best practices and measurement and data and all that kind of stuff. So I said we had work committees. So we have an awareness committee similar to what Sandra was saying in Massachusetts, and to a lot of the of you all that are doing this work. A big part of what we do is awareness. So we have newsletters that go out to our 600 members on a monthly basis that highlight resources and highlight things for people to take advantage of, and also just general education about social connection. Then we do a lot of other awareness, like we have a governor's proclamation for the month of November, or I shouldn't say the month, it's a social connection awareness week. So there's a week in November. So we have a governor's proclamation. We do a series of webinars for the general public. We do a series of webinars for professionals, lots of social media posts that we have. So here's an example of some of our social media stuff that we do. And that's ongoing. I know every week, multiple times a week, we have things happening that way. We do, radio shows, things like that. We do lots of presentations in our communities. And then we had, like I said, we had those larger learning opportunities that are virtual, and those kind of vary. Of course, we'll have them during like Awareness Week, but we also have them throughout the year too. Then, like I said, we do a lot with screening and measurement. So, how do we measure so we'll do like pilot studies in our state. We'll do different projects that, measure social isolation and loneliness. We have the different resources on our website if people can choose, what they want to use for both screening and for measurement. So that's kind of another section that we focus on. And then finally, just kind of an overview. This is just an example of like our policy champions committee. So working on legislation. So we are a nonprofit organization, so we can do legislation work. So the coalition itself isn't registered as a lobbyist or anything like that, but we can do the advocacy part of it. And so we take different policies and we run it through a committee that vets it and says, does this impact social connection in Wisconsin? If so, how does it do that? And then we decide whether or not we want to support legislation, or maybe not support legislation if it's adversely affecting social connection. So that is just a brief overview of our coalition. So feel free to check our website out, and I'm happy to talk with the rest of the group.
Wonderful, thank you. And before we jump in, I wanted to make a quick note. I'm going to put all the panelists' emails in the chat, just so that if you want to reach out to them directly, you have their information. And so for the rest of the time, I have some questions for the panelists, but I also want to open it up to the group. There is the Q&A section, the Q&A box that you can ask questions in, and I'll share them with the panelists so that they'll be able to answer. So please take advantage of that, because we have what we're planning to talk about, but we would love to answer your questions that are specific. So yeah, with that, we can jump right in. While you all were talking about your coalition work, and it's so great to see the variety of work that's being done at different levels. You talked about your origins and how the coalitions got started. One of my questions for you is that how did you engage community partners when you first started this work? Or, how do you continue to engage community partners as your work has evolved, as time goes on? It's important that we keep these connections going. So I was wondering if you could share some strategies about that.
I'm happy to start if you want me to. So we do a lot of different things, kind of taking a multi-faceted approach. So a lot of time, the in-person presentations around the state, raising awareness of the topic and inviting people to join in to the network, having like a place where they could register their name, and having that QR code, that link, kind of something that they could electronically register to and then get notifications. So that kind of brought people into the network. So we did a lot of presentations, certainly, obviously, like email listservs and things like that. But like big state conferences that where our networks were gathering. We were just intentional to make sure we were presenting there. So that was a big one. And I would say a lot of personal invitations. So the steering committee, like we have a brainstorming session, kind of a regrouping at least once a year in person. And we would literally brainstorm and list like who's not at the table and then assign, okay, I'm going to reach out to this organization, this person, you're going to do this person. We were very intentional about who we were in, making sure we were inviting. And then I would just say it just takes time to get the word of mouth to go, and then still continue to do that personal invite as well as those larger events and larger presentations and things like that that bring people in and then have a place where they can actually join too. So like an email list serve or something like that.
We did something similar, Jill. We partnered with the Los Angeles County of Department of Aging and Disabilities as well, who has a huge listserv and participated in many of the not just the general meetings, but we offered trainings, we offered activities where organizations who even wanted to learn a little bit about it could come and learn about it, and that is where a lot of people decided to join the effort. Some felt they were too small and didn't have the funding, so that's why we were really focusing on how they could partner and collaborate. The events that we held were really successful and big, but that funding ran out for that. But the great opportunity for things like these webinars, you don't have to be in the same state. You don't have to take a half a day to go to a training. You can join, you can get the information that you want to. So that we continue now to try to partner with other organizations that have an interest in this, and we will, kind of pigtail on something they're doing. We will show up and offer, an activity, and just to again make an introduction, so that when we do have our bigger event, people have heard about us and know about the issues. So that's and we keep that going through those collaborations with our other county partners.
Okay. For us, I think being at ARP and being the state president, that brought a platform for us that was a statewide visibility that was really helpful to us. Additionally, one of the 6 organizations that joined with us at the beginning was the Massachusetts Councils on Aging, which were all of the councils on agings around the state. And that brought a lot of visibility as well as membership. We then worked with UMass Boston, and during COVID, we started a Reach Out MA campaign, and that got a lot of attention. And right after COVID, we started another campaign where we were encouraging people or reminding people that as we move from our post-COVID rhythms, we must not forget about those people for whom this is the daily, their daily lives. So we brought in a lot of organizations with that campaign, including libraries. We brought in the WISE. So we were able to, and we're constantly looking who's not around our table, right? And reaching out and inviting people, caregivers. We are encouraging and inviting those organizations that provide care, home-based care, getting them in. How do we not forget about those people who cannot participate in community activities through the traditional way? How do we reach those homebound, those who are disabled? So we're constantly asking ourselves who's not around the table, and that has worked for us.
Thank you, Sandra. And I see in the Q&A box, we have a really good question from Ingrid. What data do you collect? I know some of you started to touch on that. What data do you collect, and how is it used to inform your strategy or funding?
I can maybe start because I think I might have brought that up. So we right now, the data that we collect is on individual interventions. I would say, well, there's 2 categories. One is individual interventions. So we made a statewide effort to make sure that all of our evidence-based programs were utilizing the same evaluation questions so that we could kind of compare how are we doing with increasing social connection and decreasing isolation and loneliness. So that was part of our coalition initiative, as well as then also then providing resources and providing training opportunities for organizations and communities that are doing interventions. Like we provide them with the tools and kind of recommendations and coaching and guidance as to how to measure their own individual interventions. And then we're right now, we're still learning too, looking at the different things that are happening nationally. How do we recommend that? We've got a space on our website for people to utilize the data that way. So that's one section. Then the other section of obviously we also use data, like national and state level data. So the behavioral risk factor surveillance survey data that is done, every state does that. There's some social connection questions on there that we utilize the results of those, and we put those into our presentations to make people aware of the Wisconsin state level data that we have based, because it helps us narrow down like, okay, this topic in this, or I'm sorry, this population of individuals in this age group has the highest amount of social isolation and loneliness reported. And then why it helps us kind of determine as to why. So then we'll focus more of our efforts and our educational and our reach outs to organizations that serve those individuals. So that's kind of like the macro approach to it. And then, like I said, the micro with the different interventions.
We collected data across all coalition members as far as what their interests were and the needs, kind of as COVID changed, the needs changed and where they wanted to focus, and whether that was on information, education, support, funding. And we collaborated with LACHA, that's the Los Angeles Alliance for Community Health and Aging there. And they sent out a massive survey to the whole listserv to see whether it was caregiving support or, other issues in social isolation and loneliness. Twice under two different data asks came in, at the top. So now as subcommittees, we're looking at what can we afford to do? How can we sustain what we're doing? And we're providing educational opportunities, which is what came in. People wanted to learn, what can we do? We ask how many are taking measurement and evaluation, what are they using? But because we're dealing with so many organizations, all with different capacities, we asked if they measure, we asked if they needed help in that regard, but training came up repeatedly. So we're looking at how we can provide various training options to fit the needs of the community at the moment. And again, we have 12 million people here in Los Angeles alone, so it's a lot of different types of people. So we're trying to do things for youth, and older adults. So that's and collaborating whenever possible. But you all know, it's an uphill battle, but definitely a worthy one to keep marching along.
We've held community conversations. We've had 4 regional conversations where we actually go into the community and invite people to show up, especially older adults, so that we have a better understanding of how loneliness and social isolation is impacting the communities. And we oftentimes have researchers from the UMass Boston Gerontology Institute do research projects for us, as well as Boston College School of Social Work. They're constantly working with, for example, the councils on aging to try to understand what they're doing. And basically, that's a lot of how our information come to us. But we're really not doing very much basic research per se. Ours tend to be more anecdotal, and it's really it seems to be working for us.
I would love to add just a little bit myself for South Carolina. Okay, so we have our various state agencies who collect their own data at various times. And we could utilize that since we all have that access. But as a coalition, we have not pulled any type of data yet. We are not at that point in our development. However, we are in the process of screening out screening tools for individuals once they are in the healthcare. And I think we have decided on one so far. But once we figure out which one will best fit our needs for South Carolina, we will implement that's statewide in the healthcare area. It'll be similar to the one that you take for a depression or anxiety screening, and just kind of a couple of questions here and there. And then if you have a certain score, then it's okay, well, we need to go ahead and take a deeper look with you about what's happening, what's going on. And then after that, we will also have to create a what to do if the person is identified themselves or score as socially isolated or in need of connection. So that's where we are in South Carolina right now.
Yeah, thank you, Megan, for sharing that. And I, on the on behalf of the Northern California Coalition, resonate a lot with what you were saying. I think, we just kind of restarted our efforts a year and a half ago, so we're still figuring out what's the best data to collect and how to use that. So from our perspective, we've done, I think, similarly to what Maureen was saying, a lot of surveys with our coalition members to see what is the most important priority for you. How can we help with that? And then I'm hoping down the line we can get more into the data collection from the community and all our community partners and things like that. And before my next question, I wanted to shout out Nirmala's question in the chat asking, have you heard of connections planning from the University of Rochester, the 3-session CBT protocol? I haven't, so I will be sure to check that out. But have any of you heard about that? Okay, so if you Nirmal, if you wanted to send me a link, I can share it with the rest of the group as well. And my next question is, I think, Sandra, you were starting to talk about how you and your coalition are engaging communities directly. And that's something I think a lot about in my coalition work as based in an academic institution. I'm connecting a lot with the leaders of organizations, but since we're still new, there hasn't really been a fleshed out way yet that we have directly engaged with older adults in the community, even though that's what our work is. Right now, we're very much supporting the organizations that are supporting older adults in our community. So we just started a new initiative called the Community Storytelling Campaign, where for the first time we gathered 4 older adults in San Francisco who are a part of our coalition, who are a part of our coalition organizations programs. And we just had a roundtable conversation about their stories, their lives, like what they think would be helpful in our time and day for people experiencing social isolation and loneliness. So that's one way that I've kind of thought about doing that. But I wanted to hear your perspective. How are you thinking about directly engaging community members that your coalition
Well,
works with?
we've started a number of initiatives. For example, we celebrate National Good Neighbor Day, right? Just this, I guess, September 28th. Well, we celebrated in Massachusetts the entire weekend. We kicked it off on the 25th with our lobby day at the State House. The governor, this is the second year in a row that she has created a proclamation encouraging communities statewide to host events. Block parties, you name it, just to kind of celebrate community, to celebrate belonging, and to begin to value, let's come together and value each other and make sure everybody feels welcome. So last year for the first one, we had 32 organizations or towns and communities show up. This year, we had 75, right? So we're based in the communities. We're really, we do a lot of publicity on social media and other, mainstream media, just telling people come out in the community and let's talk about it. Last year, the year before, we had what's called Conversations MA, where people were just asked to come out, let's talk to each other, let's understand what the issues are. And a lot of our members get in the community and talk with them, right? We do this Connect series on community television, which is statewide, talking about loneliness and social isolation, and then appeal to people. Here's some of the work that the coalition is doing. If this resonates with you, if it's not, if we're not addressing the problem, then let us know. So we get a lot of feedback from and that way. And we do spend a lot of time and have a very close relationship with our councils on agents throughout the state. And then we're getting more and more colleges and universities involved, and students respond to us. And it's very interesting to see at least from my perspective, how eager young people are ready to jump in and solve these problems and be a part of the solutions.
I just want to second some of what Sandra said. We invited, so we have the Gray Panthers here in California. I don't know if this group is across the country, but the Gray Panthers is one of the older kind of coordinated groups of older adults, and they hold a health and fitness day in Long Beach, and we invited them to be part of our coalition, you know, the director and the leader, and they invited us to come and speak at that event. And I will say that there were 300 older adults who then heard about this issue. We invited their feedback, and the director called me later to say, after this event, I had a line out my door of people calling saying, yes, this is what we need. So, you know, and she asked, how do you want us to do it? So I think we're doing more of that, Sandra, where we're trying to get people, you know, we've always had the senior centers involved, but again, with the directors and the CEOs, but because we all have so much we have to get done on a webinar or on a training or at a meeting, it's really hard to be at all of these events. So we're aware we want to have more of the older adults themselves and the youth that are interested in participating in this involved. And so, you know, again, every time we get the chance to talk about it and support one of their already existing efforts, we find that that's a bigger multiplier than us trying to come in and say, try this. But yeah, anytime you can invite them to participate or show up at what they're already doing, it has an impact.
Another thing I'd like to share that we've started, and it's becoming very popular, is the Happy to Chat bench movement, where we're putting Happy to Chat benches in communities. And it's amazing the stories and the feedback that we're getting from community members, how important that kind of work is.
Yeah, thank you. And I'm keeping an eye on the time. I know we're getting close to the hour. I wanted to ask one more question and hoping to hear from everyone. And it's a little bit more broad, but either to end on, you know, what advice do you have for those seeking to start a coalition, noticing a need in their community? Or you could talk about why you think during this time coalition building for social connection is really important, an important tool.
I can keep my answer very brief. Um, I would say if you're interested in starting a coalition, know that you are not alone. There are other individuals and agencies that want to start one, but don't necessarily know how to. So do your research about what coalitions currently exist, reach out to them, have an informal conversation about what went well for you, what didn't go well, what would you recommend doing. I personally did that, and then I brought all of that information to our members and actually had a couple of the state agencies representatives present after our conversation saying this is what went well for us, and then we would talk afterwards, okay, this is what we think could work here in South Carolina, but also realize that what you think can work will not work. So we have restructured ours once already, and it's so far going well. But I have a feeling in the next couple of years, we're going to have to restructure again as the larger we get and our goals and mission shift.
And I'll be brief too. I would say gather, you know, maybe it's a couple of agencies, you know, kind of outline what the goal that you have, because if it's your idea, chances are you're going to be doing a lot of the work and you're going to be doing a lot of that foundational building. And you'd be surprised when you put the word out, others will show up. And be clear. Put working committees together who you know, maybe someone's really good at communication, somebody else is good at, you know, more structural internal, and I say start small, because again, if you're trying to copy something else, it's not going to be authentic, and organic to you and your community, your neighborhood, your HOA. It doesn't have to be a state, and as you grow, you'll get involved with other organizations who are doing great work, and your voice can be heard, and this message can turn into the coalition that you're looking to create.
Yeah, I would echo that, start small. I mean, there's a lot of I worry that sometimes we think of things too structurally, which we need the structure and we need the support. But we also need to individually work on this. So I think the more that you start conversations, it's just going to ripple and it's going to have an effect, an effect, an effect. And the more we just talk about this, whether it's a small coalition, or it's a medium group, or you have a statewide or a national group, the more that we just keep having these conversations with each other, I think our culture is going to shift. I think that it just brings more awareness. I mean, I know since doing this work now, I'm much more aware of talking to people out in the community than and connect instead of just waving and smiling, actually connecting and asking how people are doing and taking time at a personal level. So I think the more that you have the conversations, the more things will naturally grow.
I agree. It's and invest in partnerships, right? I mean, I think that is critical, and I think that's the recurring theme of I think what we all have to share. And I think that with growing isolation and all the shrinking resources, it just makes sense for peace for us to work together, right? To combine our resources and ingenuity and strengthening. And I think as we begin to look forward for this work, the many people who are wanting to do this, there's no reason to start from ground zero.
Mhm.
Yes, absolutely. Well, I know we're at 1 p.m. Pacific time, so I wanted to thank the panelists for joining us today in this conversation and sharing about their amazing work across the country. I love seeing that this work is, not being done in silos, not even in specific areas, but really across the country. And thank you to the foundation for being a source of support and advocacy for that. And I wanted to thank you all for joining us and kicking off our Coalition's Social Connection Week. I put the link in the chat to our other events going on this week, as well as the link to the Foundation's action guide. And if you want to sign up for our UCSF Coalition's newsletter, the link to that is there as well. And so yeah, with that, thank you everyone. It's been really inspiring to hear about this work, and I'm looking forward to continuing it with you all.
I know.
Thank you, Anthony. Bye,
Bye.
everyone.
Bye.